Hi, I'm Rick Barron, and this week's RAF5 History of Neurology segment is on two Civil War neurologists, the civilian and the general. The civilian is Silas Weir Mitchell, and Dr. Mitchell was born in Philadelphia. He attended the University of Pennsylvania, and he then went to Jefferson Medical College. He went to Paris, and he actually studied under Claude Bernard and Pierre Robin. And then he returned to America and he started a private practice, and he also did research in toxicology using snake venom. And it was at this time that he began working with the general, Dr. Hammond, who I'll get to in just a minute. He had numerous papers, and then the Civil War broke out. He was assigned to the new neurology hospital called Turner Lane Hospital in Philadelphia. And this neurology hospital was established by the general, Dr. Hammond, and he put Dr. Mitchell in charge of this, along with Dr. Morehouse and Dr. Keene, who was a surgeon. This hospital received many soldiers who had injuries from the Civil War. At the time of the Gettysburg battle, Dr. Mitchell actually went out to the battlefield and brought soldiers back to Philadelphia for care. He and Dr. Morehouse and Dr. Keene became acutely aware of nerve injuries caused by mini-balls. And he described the term causalgia to describe the severe pain, color change, temperature change, and skin changes that occurred in patients with nerve injuries from these mini-ball injuries. And they published their experience during the Civil War in a landmark book called Gunshot Wounds and Other Nerve Injuries. He also had another book published during the Civil War called Reflex Paralysis with these two co-authors. And then after the Civil War, Dr. Mitchell published his probably most famous book called Injuries of Nerves, and a facsimile of it is here, and this was in 1874. This is really the first book on nerve injuries, and it was all stimulated by his experience in the Civil War. So here's the front piece of the three landmark books that Dr. Mitchell wrote, two with co-authors and then one by himself. After the Civil War, he also became known for a number of other things. He first described the term erythromyalgia, which we still use in our clinics to describe patients with this burning, dysesthetic discoloration of the feet bilaterally. He was really one of the first to begin using reflexes as part of the routine neurologic exam. And you can see in the picture here on the slide how he's holding a reflex hammer when he's examining a neurology patient. He described the rest cure for neurasthenia, which we have different terms for that today, but the rest cure consisted of isolation and confinement, diet, electrotherapy, and they had rest homes that patients would go to for a couple weeks at a time in order to get the rest cure to recover from their neurasthenic symptoms. And he wrote a number of books on this, both for the lay public and for the medical profession that are listed here. He was one of the founders of the American Neurologic Association, and he was its president in the early 1900s. He never had an academic appointment, and he always worked both in the inpatient and outpatient setting at the orthopedic hospital and infirmary for nerve disease in Philadelphia. So he was actually famous for some other things outside of medicine as well. So this sort of quiz question prompts you to that. And what he was really known for was he was an author of novels. Here's a list of his poetry books and novels that Weir Mitchell wrote. He was really very popular. His novels sold extremely well at the time, and there are still, amazingly, in publication. And this is a screenshot we took from some websites which are still selling the Weir Mitchell books. I like this picture of Weir Mitchell when he was very young, in his late 20s or early 30s, and I think he looks like someone from modern culture, and the hints are it's an actor who was in Animal House, MASH, Time to Kill, and who is that? That's Donald Sutherland, when Donald Sutherland was young, and then older in The Hunger Games. So the general is Dr. William Hammond, who was Weir Mitchell's friend, and as I mentioned, they began doing research together on snake venoms. But Dr. Hammond was an Army physician, and he actually did tours in New Mexico, Kansas, Florida. He was also stationed at West Point for a while, and he was involved in the Sioux Indian Wars. He briefly was the chair of anatomy and physiology at University of Maryland after he'd done his initial stint in the Army, but then the Civil War broke out. And he, at a very young age, he was appointed Surgeon General by President Lincoln. And he is the one that assigned Dr. Mitchell to lead the neurologic hospital at Turner's Lane. Dr. Hammond also founded the Army Medical Museum, which later became known as the AFIP. He really improved sanitation in the situation of war hospitals, and he developed a pavilion system for Army hospitals, which is used for generations. He became crosswise with the Secretary of War, Mr. Stanton, and he was court-martialed. He was later restored to his rank in 1878, and here the bottom picture is Dr. Hammond putting on his uniform late in life after he was restored to his rank of general. After the Civil War, he set up a practice in New York that was devoted really to nervous and mental disease, and his was really the first practice of that kind. He was on the staff at Bellevue Hospital, and he lectured at Columbia, and he was later on the faculty at University of Vermont. He wrote what I consider the first major textbook on diseases of the nervous system published in the United States, and it's called A Treatise on Nervous Disease. It's really an impressive volume in which he covers all areas of nervous disease, and it's actually well illustrated as well. He described the term athetosis, and he speculated that the cause of athetosis was a lesion in the basal ganglion or corpus striatum. Of course, he was correct on this, and this was called Hammond's disease for many years. He actually did research on lithium for mania, which is amazing when you think about it. That's still one of our main drugs for mania. And of course, with Weir Mitchell, he co-founded the American Neurology Association. He was a critic of spiritualism, which was very fashionable in the late 1800s, and he wrote books basically saying that spiritualism was really a bunch of hooey. And he wrote 7 novels. So he was not quite as prolific as Weir Mitchell, but he was a novelist as well. And so you wonder what it was about these neurologists in the late 1800s who not only were great physicians, but they also had a penchant for writing novels that were very popular at the time. So I hope you've enjoyed this RAF5 about 2 Civil War neurologists, the general and the civilian. Thank you very much.